Disclaimer: we are not healthcare professionals nor are we authorities in information dissemination. That is why our focus was to share the gospel of Christ by any means to as many people as possible. Okay, good day everybody. In this first video, I want to explain to you the 10 of the worst pandemics in history. So the difference between pandemic and epidemic is that epidemic is local and pandemic is worldwide or global. So my source for this video is mphonline.org. So here are the 10. Okay, so for introduction, scientists and medical researchers have for years have differed over the exact definition of a pandemic. Is it a pandemic or an epidemic? But one thing everyone agrees on is that the word describes the widespread occurrence of disease in excess of what might normally be expected in a geographical region. Cholera, bubonic plague, smallpox, and influenza are some of the most brutal killers in human history. And outbreaks of these diseases across international borders are properly defined as pandemic, especially smallpox, which wrote history has killed between 300 to 500 million people in its 1200 year existence. A final note: the most recent outbreak of the Ebola virus, which has killed thousands of people, is still confined to West Africa. It may someday be pandemic, but for now is considered an epidemic and is therefore not included on the list. So ito po yung 10. The top 10 na worst pandemics in the history. Okay, so HIV AIDS pandemic, number 1, at its peak on 2000, yun. So 2005 to 2012, but at its peak, so death toll, nilagay po nila dito ay 36 million people died. Okay, so pinasa lang din sa atin ng numbers na ito, but it's pretty reliable naman. So the cause is HIV and AIDS, first identified in Democratic Republic of Congo in 1976. HIV AIDS has truly proven itself as a global pandemic, killing more than 36 million people since 1981. So pretty large po ang sakop niya. Currently, there are between 31 to 35 million people living with HIV. The vast majority of those are in sub-Saharan Africa, where 5% of the population is infected, roughly 21 million people. As awareness has grown, new treatments have been developed that make HIV far more manageable, and many of those infected go on to lead productive lives. So between 2005 and 2012, the annual global deaths from HIV/AIDS dropped from 2.2 million to 1.6 million. Okay, the second one is the flu pandemic of 1968. Death toll 1 million people, caused influenza. Category 2 flu pandemic, sometimes referred to as Hong Kong flu. The 1968 flu pandemic was caused by the H3N2 strain of the influenza A virus, a genetic offshoot of the H2N2 subtype. From the first reported case on July 13, 1968 in Hong Kong, it took only 17 days before outbreaks of the virus were reported in Singapore, Vietnam, and within 3 months it spread to the Philippines, India, Australia, Europe, and the United States. While the 1968 pandemic had a comparatively low mortality rate, 0.5%, it still resulted in the deaths of more than a million people, including 500,000 residents of Hong Kong, approximately 15% of its population at the time. Right, so number 3, yung Asian flu of 1956 to 1958 that told 2 million, caused influenza, was a pandemic outbreak of influenza A of the H2N2 subtype that originated in China in 1956 and lasted until 1958. In its 2-year spree, Asian flu traveled from the Chinese province of Guizhou to Singapore, Hong Kong, and the United States. Estimates for the death toll of the Asian flu vary depending on the source, but the World Health Organization placed the final tally at approximately 2 million deaths, 69,800 of those in the United States alone. So number 4 on the list is the flu pandemic again of 1918, which, if we will compare that to the flu pandemic of 1968, the flu pandemic of 1968 killed only 1 million people. But the flu pandemic of 1918, which technology is not on its peak, so mas advanced na po tayo ngayon. So yung dati hindi pa advanced. So flu pandemic 1918, death toll is 20 to 50 million. Okay. The cause is influenza between 1918 and 1920. A disturbingly deadly outbreak of influenza tore across the globe, infecting over a third of the world's population, ending the lives of 20 to 50 million people. Of the 500 million people infected in the 1918 pandemic, the mortality rate was estimated at 10% to 20%, with up to 25 million deaths in the first 25 weeks alone. What separated the 1918 flu pandemic from over influenza outbreaks was the victims. Where influenza had always previously only killed juveniles and the early or already weakened patients, it had begun striking down hardly and completely healthy young adults, while leaving children and those with weaker immune systems still alive. So the number 5 is the sixth cholera pandemic of 1910 to 1911. Death toll is 800,000 plus. The cause is cholera. Like its five previous incarnations, the sixth cholera pandemic originated in India, where it killed over 800,000 lives before spreading to the Middle East, North Africa, Eastern Europe, and Russia. The sixth cholera pandemic was also the source of the last American outbreak of cholera, 1910 to 1911. The American health authorities, having learned from the past, quickly sought to isolate the infected, and in the end, only 11 deaths occurred in the United States. By 1923, cholera cases had been cut down dramatically, although it was still a constant in India. Okay, the flu pandemic, 1889 and to 1890, that toll 1 million again. So, ang flu po, lagi nasa listahan. Okay. The cause is influenza, originally the Asiatic flu or Russian flu as it was called. The strain was thought to be an outbreak of the influenza is virus subtype H2N2, though recent discoveries have instead found the cause to be influenza A virus subtype H3N8. The first cases were observed in May 1889 in three separate and distant locations: Bukhara in Central Asia, Turkestan, Athabasca in northwestern Canada, and Greenland. Rapid population growth of the 19th century, specifically in urban areas, only helped the flu spread, and before long the outbreak had spread across the globe. Though it was the first true epidemic in the era of bacteriology, and much was learned from it. Okay, yeah. Though it was, yeah. And in the end, the 1889 to 1890 pandemic claimed the lives of over a million individuals. All right. So, pang ilan na po tayo? 1, 2, 3, 4, 5, 6, 7. Third cholera pandemic of 1852 to 1860, death toll 1 million, caused cholera. Generally considered the most deadly of the seven cholera pandemics, the third major outbreak of cholera in the 19th century lasted from 1852 to 1860, so approximately po 8 years. Okay. Like the first and second pandemics, the third cholera pandemic originated in India, spreading from the Ganges River Delta before tearing through Asia, Europe, North America, and Africa, ending the lives of over a million people. British physician John Snow, while working in a poor area of London, tracked cases of cholera and eventually succeeded in identifying contaminated water as the means of transmission for the disease. Unfortunately, the same year as his discovery, 1854, went down as the worst year of the pandemic, which 23,000 people died in Great Britain. So number 8, this is one, okay, if not the most, but this is one of na pinakamarami pong pinatay na pandemic is the Black Death of 1346 to 1353. Death toll is 75 to 200 million. Caused bubonic plague. From 1346 to 1353, an outbreak of the plague ravaged Europe, Africa, and Asia, with an estimated death toll between 75 to and 200 million people. Thought to have originated in Asia, the plague most likely jumped continents via the fleas. Okay. Lisa po, living on the rats that so frequently live aboard merchant ships. Ports being major urban centers at the time were the perfect breeding ground for the rats and fleas, and thus the insidious bacterium flourished, devastating three continents in its wake. So, if I am not mistaken, marami pong nakaligtas na Jews at that time. So, many people sa Middle East or Europe ay namamatay, but the Jewish people are not dying. So dahil meron silang tradition of washings, paghuhugas, pagiging malinis, and if this originated with rats, so kung merong mga daga sa bahay nyo nung panahon na yon, then doon ay papasa yung plague na yon o yung bubonic plague. Then kung malinis sila sa bahay nila, hindi papasukin ng daga, safe sila. So that's the reason why. So number 9, Okay, plague of Justinian, 541 to 542. Death toll 25 million. Caused bubonic plague. Thought to have killed perhaps half the population of Europe, the plague of Justinian was an outbreak of the bubonic plague that afflicted the Byzantine Empire and the Mediterranean port cities, killing up to 25 million people in its year-long reign of terror. Generally regarded as the first recorded incident of the bubonic plague, the plague of Justinian left its mark on the world, killing up to a quarter of the population of the eastern Mediterranean, devastating the city of Constantinople, where at its height, it was killing an estimated 5,000 people per day and eventually resulting in the deaths of 40,000 of the city's population. All right. So lastly is the Antonine plague 165 AD. Death toll 5 million, cause unknown. Also known as the Plague of Galen, the Antonine Plague was an ancient pandemic that affected Asia Minor, Egypt, Greece, and Italy, and is thought to have been either smallpox, or measles. Though the true case is still unknown. The unknown disease was brought back to Rome by soldiers returning from Mesopotamia around 165 AD. Knowingly, they had spread a disease which would end up killing over 5 million people and disseminating the Roman army. So in our next video, we will explain to you what you need to know about the COVID-19 na ngayon ay kinakatakutan ng maraming tao, especially sa Pilipinas kung nasaan po ako nakatira. And napaka-importante maintindihan natin. So, it brought fear. The media has brought fear among people. People are panic buying. So, what you need to know about it on the next video. So, see you in the next video.